Greetings to the citizens of Elizabeth City and our neighbors in the surrounding areas. For more than a year and a half, our country has been experiencing a deadly coronavirus pandemic. All of us have been touched by the pandemic in some way. Whether you were infected by the virus, know someone who was infected, or knows someone who not only got sick from the virus, but may have passed away as a result of complications from the infection. There was a period of time this year in which it appeared that we were defeating the virus because the vaccines that were made available was combating the virus quite well. Unfortunately, not enough of us took advantage of being vaccinated. And now we have a new mutation of the coronavirus called the Delta variant. The Delta variant spread has become a pandemic among the unvaccinated. This variant is doubly infectious and more deadly than the previous virus that we dealt with all last year and up to June of this year. Therefore, I asked our city manager to contact Albemarle Regional Health Services Director, Mr. Bettie, to see if he would be available to speak directly to our citizens regarding the surge in new cases and deaths caused by the Delta variant. So please listen to the information that he will be sharing in order to protect yourself and others. Thank you, and I now yield to Mr. Betts.
Mayor Parker, thank you for having me here today. You are correct. The Delta variant has definitely complicated things as we are all trying to emerge from the pandemic. A little more than 50% of our citizens are now considered to be fully vaccinated from the virus. But as you mentioned, the Delta variant has created more complications because the virus continues to mutate as it moves from one host to another, and the process of vaccination protects us, but only so far, because the more the virus continues to mutate, it could potentially mutate beyond what the vaccines are capable of protecting us from. And we're seeing it every single day in the communities we serve. Over 95% of the hospitalizations and the active cases are the Delta variant, and they are unvaccinated individuals. Statewide and nationwide, less than 1% of the cases that we're seeing are what you're hearing called the breakthrough cases, that are folks that are already immunized, vaccinated, getting sick. And even in those cases, their symptoms are usually very, very mild. So we do encourage everyone, if you've not been vaccinated, please get vaccinated. It protects yourself, it protects others, the ones that you love, and it collectively will help us all emerge from this pandemic sooner rather than later, because we want to continue our momentum. We want to try to get ahead of it. Historically, you can look at the polio epidemic, smallpox, and all of those other things that have come before. And until we can get herd immunity, large masses of protection, we will continue to be vulnerable. And perhaps I was discussing this with some folks the other day, and perhaps our generation, my generation, hasn't done our job because with communicating to younger folks, because my parents and grandparents, they had those smallpox scars where they were tested, and they had the stories of polio from their loved ones being impacted and losing those loved ones. And folks today, our younger generations, fortunately haven't seen a pandemic and the impacts of communicable disease in a wide population-based epidemic like what we're seeing now. So we definitely encourage everyone, please get vaccinated. If you need a vaccine and you're homebound, you can call the local health department and we will actually come to you in your home. If you need transportation, we can arrange transportation. We want to eliminate any barrier to care. for you to protect yourselves and others. And as another reminder, as we approach the fall season, we were very, very fortunate to have a very limited cold and flu season last year, and I believe that's heavily due in part to our social distancing, our increased emphasis on hand washing and increased sanitation, and so we're hopeful that we can achieve that again this year and keep our health professionals focused on preventive care and well care instead of having to treat the sick. So, Mayor Parker, is there any other issues that you'd like me to address this morning? Or
Well, the herd immunity, some people may not understand what that's all about. You said we're at 50%, and I believe that the president would like for us to be at least 70%. So if you could kind of just a little bit more expound on that herd immunity.
Absolutely, I'll be glad to. Herd immunity is just that. It's when a vast majority of our citizens are protected against the virus. And so, as I said earlier, the virus is going to continue to mutate as it moves from one person to the next. So the vaccine initiates a response in our body to protect us, to ward the virus off. As the virus continues to mutate, those protections can wane because the virus is smart. It learns. Every time it moves into someone else, it changes slightly. And so the quicker we can get everyone fully vaccinated, the better we'll have a chance of getting in front of it to protect our citizens, like in the past with smallpox and polio and things of that nature. We do have about 50% of our citizens that we have reached with the vaccine, and there's also an implied immunity of another 18 to 20%. What I mean by implied immunity is simply just those folks that have had COVID before. They've been sick, they've recovered, and they have some functioning immunity in their bodies right now because they have been sick. Now, we do still encourage those folks after a period of time to go ahead and get fully vaccinated, again, to make sure that we're all as fully protected as we possibly can be. So thank you for that question.
And I have one other question.
Sure.
A lot of the citizens question the efficacy of the vaccines. They're concerned about the difference, Pfizer, the Moderna, and the Johnson. Could you just indicate to them how safe they are? And even though they may not be FDA approved, that is coming soon, but they would not have put it out there for us as an emergency vaccine if it was going to be detrimental to our health.
Absolutely. That's also a very good point, good question. I've personally received the vaccine, and all of my family members, and I would never ask them to do anything that would cause any harm to them in any way. I find great comfort in the platform that the vaccines are built on has been around for decades. The RNA platform for vaccines has been around a long, long time. We are operating under an emergency use authorization, an EUA right now, but Mayor Parker, as you illustrated, the FDA is considering full approval. The FDA is considering full approval right now of the Pfizer vaccine, and I had heard that was going to be considered prior to January, and I believe that timetable has now been moved up, and we may hear something as soon as the month of September. So I hope people will find greater comfort and greater peace, greater confidence in the vaccines as we continue to move forward and hopefully move beyond this pandemic.
And I think that's it. And I just want to thank you with an elbow for being here and expressing it so well to the public. And I just want to finally say to the public is that it is very important that you take heed to the information that the Director of the Health Services has shared with you, because it's not only about you as an individual, it's also about the other people around you. And keep in mind that at this point, about 95% of those who are getting sick with this Delta variant and passing away with it are those who are unvaccinated. And it's not just happening to older people now. It's across the spectrum, and it's even infants have it and are unfortunately passing away. So keep in mind that young folk that are under 12 years old cannot take the vaccine. It has not been approved for them taking it at this point. So if you're walking around with the infection, even though you may be asymptomatic, you could pass it on to the youth, to the younger ones. And that is very scary as far as I'm concerned. So please think about it and please make the right decision because, again, we want all of us to be safe, and that includes others around you and not just you as an individual. Again, thank you for listening, and I thank Director Betts for being here with us this morning. I am just so pleased that he was able to join us. Thank you again.